NHSC site application process, the first video in this PowerPoint presentation. We'll be discussing eligibility today for the NHSC site application. So everything we talk about today can be found at the Health Resources and Service Administration, or HRSA website, at the National Health Service Corp section, and in the NHSC sites. And everything we reference is found on the NHSC site guide reference as well. So that can be found there in the circled box. So the first thing we're going to discuss is eligibility types. So there are certain sites that are approved and eligible to be a National Health Service Corps site. So there are two different site types. There's the auto-approved sites and then other eligible sites. So the auto-approved sites, this would be sites that they actually don't have to apply when it's the site application cycle opens. They can apply actually anytime, any point during the year, but of course can apply during the site application cycle. So these would be your federally qualified health centers, federally qualified health center lookalikes, Indian Health Service facilities, programs, and Indian Health hospitals, federal prisons, and Immigration and Customs Enforcement Health Service Corps facilities. Other eligible site types would be state prisons, centers for Medicare and Medicaid services, certified rural health clinics, critical access hospitals, community mental health centers, state or local health departments, community outpatient facilities, private practices, school-based clinics, mobile units, free clinics, and substance use disorder treatment. And these other eligible site types, they must submit a site application during the new site application. And for both type of sites, need to recertify every 3 years. So the first eligibility point is HPSAs, or health professional shortage areas. So National Health Service Corps sites must be located in entry patients from a federally designated HPSA. So each site has a designated HPSA for the specific category in which the clinician that they recruit or a participant of the NHSC program would serve. So if an individual is an adult medicine physician, you would need to have a primary care shortage designation. If you're hiring a social worker, there would need to be a mental health shortage designation. And if you're recruiting a dentist, obviously a dental shortage designation. Sites providing substance use disorder services may use either a primary care or mental health shortage designation. But if you want any more information about HPSAs, definitely contact the state primary care office for Michigan when applying, and they'll have more information about HPSAs. And speaking of the primary care office, here are some important contacts and also websites. So Miguelina is very much an expert in HPSAs. She works in the Michigan primary care office. So asking her any questions, her email's there. And then if you would like any more information outside of these PowerPoints, more in-depth questions, Megan over at the primary care office also is the administrator for the NHSC site application for Michigan. So she can be able to answer your questions as well. And then finding information about your organization's HPSA or your site HPSA facility type designation, you can go to that website down there below, and also the Shortage Area Tools website for both the geographic and facility type HPSAs. So starting the application process, you are going to go down to that link below. This is the BHW portal and website, and you are going to either click, if your site is an auto HPSA, you'll click the auto HPSA point of contact, or if it's not one of those auto HPSA site types, then you would click an NHSC or other site point of contact. So site point of contact, sites must have at least 2 active points of contact, except for solo private practices. Points of contact must cover the following roles. So there's 3 roles: administrator, personnel verifier, and recruiter. And one point of contact can have multiple roles. So sometimes we see someone as the personnel verifier and the recruiter, but you also can have more than the 2 contacts. So you could have, I've seen up to 5 or 6, but you at least have to have those 2 points of contact. And participants of the NHSC loan repayment should not be a point of contact. That's just a conflict of interest, more seen in those, again, solo private practices. They just really, HRSA, the NHSC program, kind of just doesn't look great, really, but really having somebody else be that point of contact. And then points of contact must activate and maintain a BHW portal account. So let's say you do have 6 individuals within your organization on the BHW portal account. They still need to verify their account information, confirming their email address associated with the account, even if maybe they're not going to be in the portal as much as yourself or the administrator. They need to still activate their account, or it's not going to be an active account on the BHW portal. So the administrator, they must own, oversee, or manage a significant portion of the organization. They should have the ability to answer questions about the organization's policies and operating procedures, basically acting on behalf of the organization they serve. And they're required to complete the National Health Service Corps site application and electronically sign that site agreement as well. Personnel verifiers, they're going to verify the employment and the service of the NHSC participants that are within your organization. They complete the employment verification forms through that BHW portal at the time of hire, and then report participants' time away from the site. So participants in the NHSC can have an allotted amount of time away from the site. It can differ from, your organization's human resources policies, time away, but that's just, for if let's say a participant goes on maternity leave, extended longer time, this is where you document it on that online in-service verification form every 6 months. And recruiters. So they recruit new employees for the organization. They post all NHSC eligible vacancies on the Health Workforce Connector website, and they complete and periodically update the online site profile using the BHW portal. So creating the application, so you would log into the Bureau of Health Workforce Customer Service portal, that BHW portal. Then you create a new site from the left margin of your homepage, and then go to the site dashboard and click Start an NHSC application to begin. And you must complete all the sections of the application and upload all required documents before submit it. Once you submit your application or applications, you can no longer add information or upload new documents. So making sure, really double, triple checking before submitting your application that you have all the required documents and information. So this is just kind of the overall summary of what's going to be included and what for certain site types is needed, and some are exempt. We'll go through it in the other PowerPoints, but just this, as you're looking over this PowerPoint, just kind of seeing, okay, what is my organization? It's an FQHC, is it a rural health clinic, free clinic, and what is expected to be submitted for the NHSC site application. So once you're ready to submit the application, obviously review the NHSC site agreement, confirm your site's compliance with NHSC requirements, and electronically sign the application and submit the new site application by clicking on the Submit tab. And then once you submitted, within 21 days, the Michigan Primary Care Office will review it, determine to see if your site is eligible for the NHSC site requirements. And then once they give their evaluation and comments, they will pass it on to HRSA. So HRSA will review it and evaluate it, along again with those comments and recommendations from the primary care office, and then they will render a final decision. So the review process can take about 6 to 8 weeks to complete. Sometimes it can be shorter, sometimes it can take longer, just depending on how much applicants they do receive and applications they go through. So it could take longer, could take shorter, it just depends. But the final decision on a new site application is communicated to the site of point contact through the BHW portal. And for any questions, feel free to email me as you're looking through these PowerPoints and listening to this presentation, and just feel free to ask any questions.